head-to-toe demonstration, you want to explain to your patient that this is a more thorough assessment. So you obviously will be touching them, so just making them aware of that. So starting at the top, you want to make sure that you're looking for D claps and listening and feeling for tics, okay? So starting at the top, I'm going to take my hands here, and I'm just going to check the head for any lumps, bumps, or bruises. Obviously, I would have gloves on right now, and I'm just checking your gloves periodically for any bleeding. You want to work your way down to the ears. You want to look for signs of battle signs, which is bruising around the eyes, and then you're going to look for presence of cerebral spinal fluid that might be leaking from the ears. Then you want to work your way down to the forehead, palpate down the cheekbones, the nose. Oftentimes, if someone has a head injury, they can have something called raccoon eyes, which is bruising around the eyes. If you have a pen light, you want to check for pupillary reflex, and then you're going to work your way down. And can I just get you to open and close your jaw for me? Perfect. Check for grindus, crepitus, or anything like that. And then I'm just going to ask my patient to run their tongue around their teeth for any presence of loose teeth. Perfect. Working your way down the neck, you're going to check for something called jugular vein distension or tracheal deviation, which you'll see coming from their neck. Then you want to take your 2 fingers, and you're just going to work around the collarbone. Check for any fractured collarbones. Awesome. And then you're going to take your arm, and you're just going to check for sternal stability by taking your arm and pressing it right down the center. If it moves, that indicates something of like a fracture and something abnormal. Then you're going to move your way down to the abdomen. I'm just going to ask my patient, can you take a deep breath in and out for me? Perfect. You're going to check for something called paradoxal movement, where they're not using their accessory muscles properly. And then obviously, I'm just going to now check the 4 quadrants of the stomach. So is it okay if I just lift up your shirt a little bit? Perfect. All right, so the stomach is just sectioned into 4 quadrants like this. Obviously, you want to look for any signs of subcutaneous emphysema, any sucking chest wounds, or anything like that. And I'm just going to palpate the 4 quadrants for any tenderness, okay? Any pain at all here? Good. Any pain at all here? Here? And here? Awesome. I know. So if the abdomen tends to be really, really stiff, that could be indicative of something like an internal bleed. And a normal abdomen should be soft and non-tender, okay? Next, you're going to work your way down to the pelvis. I'm going to take my hands. I'm just going to check pelvic stability. Perfect. Shouldn't rock around too much or anything like that. If they're a male, you would check for something called priapism, which is an erection. And then you're going to check for incontinence, which also could be indicative of a head, neck, or spinal injury. Working my way down, I'm just going to take my hands. There's a chair there. I'm going to take my hand. We're just going to get a little personal here. I'm going to take my hands, work my way down here. Again, you're checking your gloves at all times for any presence of bleeding. Perfect. Awesome. As you work your way down to your extremities, you want to make sure that you're also checking for your CSSMM, so circulation, strength, mobility, and medic alerts, as well as sensation. So I'm working my way down, and is it okay if I take off your socks here? Perfect. I'm going to feel for presence of their pedal pulses. Awesome. If you can't feel their pedal pulses, you just want to note that if they're warm, okay? Perfect. And then I'm going to get my patient to close their eyes and tell me which toe I'm touching. Which toe?
Right, big toe.
And which toe?
Left pinky toe.
Awesome. And now we're going to just test for strength. So can I get you just to press your feet up against my hands here? Let's up and then press down. Perfect. And you'd only test for strength if you weren't cautioning for C-spine, because you don't want to get them moving their limbs, obviously, because you want them to stay nice and still. Next, can I get my patient just to bend your knees up? Perfect. And that's, again, testing for mobility. Lastly, you want to check for their circulation in their arms. So right going down, checking my gloves. Around. Perfect. And then checking for my radial pulses. Awesome. In the hands, you can easily check for cap refill for circulation. And then again, mobility. Can I just get you to reach up and grab my hands here? Perfect. And then lastly, sensation. So can I get you to close your eyes and tell me which finger I'm pinching?
Right. Big pointer finger.
Okay, good. And then which finger?
Left pinky.
Perfect. And that is your head to toe.